In one of my conversations, I went to see Dr. Bain and I was concerned about my upper eyelids. And during the conversation, he said, I don't think it's your upper eyelids that are the problem. Again, being blunt, which is what I needed. And he said, you need to have underneath your eyes fixed if that's what you want to do to correct your problem. And I was like, what? So he gives me the mirror and he shows me and he explains. And the interesting thing is he has this habit of drawing on the paper on the table where patients sit, and he always maps out the anatomy for me. He explains, he shows, whether the way the musculature is, and I like that. I want to know exactly what was going on. So he showed me what was going on underneath my eyes, and it was a revelation to me. And the more he explained it and I understood what was going on, I was really excited because that is what I needed to have happen. So we did underneath my eyes. And the best thing about that is I'm very private. My mom, my sister, my father, no one in my family even knows I had my eyes done. And that's why I love the work that he's done for me, because no one looks at me and goes, you've had plastic surgery. That's what I really like about Dr. Bain's work. In the process of when we were determining about underneath the eye, I was also discussing with him, where my brow line was sitting, and all of a sudden you wake up one day and you've got your sunglasses on and you can't see your eyebrows. So it was a combination of things. But at this point, after all the stress I'd been through, all of a sudden, when you go through a lot of stress in your life, you can notice a rapid aging. And I take care of myself in all other ways, so I was really interested in finding out what I could do. But more importantly, I take care of all these other aspects of my life, working out, you take good care of your teeth, you eat right. And the more I thought about it, it's like you work so hard on your appearance in all these other ways. And it really, for me personally, it was a very difficult decision to say, okay, I'm going to have plastic surgery to fix something of this nature. And I decided to do that anyway. We did it at the same time we did the procedure that was underneath the eye, and we did a brow lift. And it's been a year and a half, and I'm so glad that I did it. I can't say that I have been unsatisfied in any way with having done that procedure. When I had the two procedures done at once, the brow lift and the under the eye done, I took off about 3 days of work, which is, most people might want to take a little more time off. I didn't really care because I'm isolated. No one could see me. I still had a few stitches, but I felt great. And Jessica, Dr. Bain's nurse, and she's like, no, you need to stay calm, you need to relax. And so when you invest in yourself and you invest in something like this, you have to follow doctor's orders to the letter because you want the good results. But I didn't have any problems. I did the surgery on a Friday and I was back to work the following Thursday. I could have gone Wednesday if she'd have let me, but they want you to take care of your body. You're healing. It wasn't that much of a downtime for me that I thought that it really was detrimental to my lifestyle. The follow-up care with Dr. Bain is almost a little above and beyond. I don't want to get Jessica, the head nurse, in trouble by saying this, but having been a patient of theirs for over a course of a couple years, she's actually come to my home to follow up on me after surgeries. One time, the first one, the one that I've discussed with you, the eyebrow and the under the eye, she literally came to my home and stayed with me for 4 hours. I don't know how normal that is, but I do know that because I talk to her frequently and she has become a good friend of mine since then, I'll be talking to her about something and she's like, oh, I'm going to a patient's home, or, I'm going into the office on Saturdays. There's so many times when I'm like, wow. And even though she's my friend, just knowing the amount of work that they do, I can call her with a question and she says, hold on, I'll call you back. And she calls Dr. Bain directly, after hours, weekends. And it's not because it's just me that I happen to be friends with her. I know she does this with all of their patients, and he's the same way. And I'm getting emails or I'm getting phone calls, we need to have you in here on a follow-up. When you think that you're done, you're still having them contact you to say, we want to come in, we just want to check and see how you're doing. And I think that that's really amazing. It's been a year and a half since I had my first procedures, and I know that I'm going to have something done with my breasts because we need to redo them. I know that I am going to be having something that's, a bigger surgery to repair something from somebody else's work, and I can't tell you that I would go to anybody else. I'm happy, I'm excited, and I've found a doctor that I can trust, and I believe in him, I believe in his staff, and that's a relief. I rarely recommend anything that I can't really be behind 100%, but I would tell them to go see Dr. Bain, because if they shouldn't have it done, he's going to tell them that too, and that's what I really appreciate the most.